Hello, I'm John Cruz, and today this FaceTime Live is going to be talking about anxiety and fear in the time of coronavirus. Um, although it's directed at people with ADHD, hopefully there will be many tips and tools today that are applicable to people with or without ADHD. And the format, I'll be talking again for 15 to 20 minutes. It's fine if you have questions to type them in while I'm talking, and if there are no questions at the end of the session, I'll just shut it off. You certainly can post questions at a later time if something comes up. So starting out with what is fear and anxiety. Fear is usually considered a reaction when you perceive that there's danger or damage about to happen to yourself. And anxiety, different people define slightly different ways, but usually the difference between fear and anxiety is pertaining, one, to a future threat, not an immediate threat, or two, where the danger is either uncontrollable or unavoidable, or so those are the main issues. Why many of us are feeling more fear and anxiety at this time is certainly that coronavirus is a threat to many people's health. It's a threat to our way of life, our income for many people. And a particular aspect which I have been highlighting to my patients and friends from the beginning, and I'm seeing getting a fair amount of press recently, is that the uncertainty of this current pandemic makes it much harder for human brains to deal with than if it were just a bad thing. So, for example, if we were told back in March, you're going to have to shelter in place for 100 days and not go out and not communicate with people or limit it as much as possible, people would have moaned and groaned and said that's horrible, but by day 3 or 4, they'd be counting down the days and counting up the days when this will be over. On the other hand, with the way the coronavirus is now, nobody knows how long it's going to be a threat in our environment. Nobody knows for sure whether there'll be a big lull in summertime or no lull in summertime. Some of the coronaviruses, other viruses, do show clear seasonal variations in how prevalent they are, and others don't seem to show that. We know the virus, like all viruses and all living organisms, is mutating. Most of the time, those mutations don't have a huge impact, but it's possible that this could mutate to something worse, either more infectious or more deadly. It's also possible it could mutate in other directions, become less infectious or less deadly when people do get it. We don't have any certainty about still how long immunity is conferred if you have it, and how absolute or consistent that immunity is. We don't know. We don't have a vaccine yet. We don't know when mine might be developed. We don't know when effective treatments for people who are sick with it are going to be developed. And another element of uncertainty adding to the current situation is not knowing how well our local government's going to respond, how well your employer is going to be responding, either in terms of allowing or providing you with supplies, treatments, the ability to work from home, or a whole range of variables are there that we're not faced. So again, if this were a clear, discrete danger, that would be easier to deal with than all the uncertainty that's packed into this. So another angle I'm going to jump into is why people with ADD in particular may be more prone to fear or anxiety. One is simply that some of the symptoms of ADHD, some of the inattentiveness, some of the impulsivity, some of the distractibility contribute to anxiety. So if you are missing information because you're not paying attention to it, some part of you may be conscious and aware that you're missing information, whether that's in a social setting, whether it's in a bigger context, but knowing that you are missing information is a part of what many people with ADHD deal with, and that adds to anxiety. Having had, many people with ADHD have issues with impulsivity or with emotional regulation problems. This can lead to less certainty in your social alliances. You don't know who might have your back, or you might not know or feel who might be judging you for past mistakes or problems. So that leads to heightened uncertainty, heightened anxiety. Just the fact that thoughts are always bounding around, jumping from thing to thing, means that you are exposed to a greater variety of thoughts or issues, and that means you're going to be exposed to a greater number of problems overall to worry about. Furthermore, for most people with ADHD, organization of thoughts, planning of thoughts is more challenging, and that makes it harder to come up with a coherent and effective way to deal with threats when they are present. And one other sort of different realm is that we know ADHD is highly influenced by genetic factors, and that many of those genetic factors are, while some of them do seem very specific to ADHD, many of the genetic factors which make you a tiny bit more vulnerable or susceptible to developing ADHD also actually slightly increase your vulnerability to becoming depressed, anxious, or a whole host of other mental health challenges. So those are all contributing to fear and anxiety problems. So how do we deal with this? So I will get back to one of the things I said in the scheduling discussion a few weeks back. Pay attention to the 4 basics. Those are sleep, eating, exercise, meditation. So with sleep, we know sleeping well is one of the most effective ways to diminish anxiety. Conversely, we know that sleep deprivation is one of the biggest triggers for having full-blown panic attacks. So getting good sleep, and that means not just sufficient 7-8 hours, but getting at the same time each night is important. Having meals at a regular time and sufficient food is also a way to decrease anxiety. Exercise, there's a number of studies showing that people who are more physically fit are actually less prone to anxiety, including full-blown panic, and that exercise is good for reducing, for many people, helping control ADHD symptoms, but also has benefits for depression and anxiety disorders. And then the fourth of those big 4, as I say, is meditation. And I'll say a little bit more about that. The meditation, and there are many different formats of that or ways you can use it, often has at least 3 different components. So one component of meditation is often a focus on breathing or regulation of breathing. Part of what happens, part of the physiologic response to fear or anxiety is a ramping up the sympathetic nervous system. That's often called the fight or flight response. I'd say for fear and anxiety, it's more often the freeze or flee response. So usually fear and anxiety directly don't engage you in fighting, but they do engage you in either shutting down or getting out of there. So the parasympathetic nervous system is the alternative automatic system we don't usually have to think about, that regulates our breathing, our heart rate, our digestive system, other bodily functions. So we have 2 competing systems, and learning to regulate your breathing is one of our most potent pathways into activating the parasympathetic nervous system, which, to oversimplify, is a calming, modulating, dampening down system. Another component of meditation often is muscle relaxation. Some of it can be overtly progressive muscle relaxation exercises, which start often at the head or the toes and work their way gradually through the body. But we know again that given that fear and anxiety ramp up muscle tension, that's part of their physiologic response, working counter to that by physically relaxing the body can be a powerful component, regardless of which specific meditation approach you take. And a third important part of most meditation practices is some aspect of mindfulness. And it may seem strange, but a large component of anxiety is a problem with focus. And by that I mean, ideally, if you're in a flow state, if you're focusing on what you are doing, what your project is at hand, you're not worrying about how it's going to turn out. You're not going to worry about what else the rest of the world is doing. You're not going to worry about what other people are thinking of you. So when your focus is, I would say, misdirected to all those external things that you can't control, that may be judging you or may be causing threats to you, so learning through mindfulness to redirect your focus back onto what you're doing is helpful for reducing anxiety. So again, getting good sleep, getting regular exercise, getting regular meals, and a daily meditation or simpler yoga, relaxation, some practice to help calm down the body. And again, there's a number of studies showing that daily meditation helps not just in the moment, but it does help train your body to make you more resilient should stressors come up and to help you get out of them more quickly when they arise. I'm going to spend a little more time. So there's huge numbers of meditation webs out there. There's lots of people teaching breathing, relaxation, mindfulness practices. I'm actually not going to talk too much more about those. I'm going to go to two sort of, not oddball, but sort of maybe less, people pay less attention to these techniques or approaches. One is from cognitive behavioral therapy, which also has a range of tools for reassessing, helping change your thoughts. One, examining what your maybe not explicit, but underlying assumptions are as to why a situation is dangerous. So I'm going to focus on just one tool of cognitive behavioral therapy, and that's setting up a worry time each day. Now that might seem counterintuitive, that actually practicing worrying, aren't you going to get better at it? Isn't it going to draw more worry or problems into your life? And given that most people are anxious, don't like that feeling, asking them to practice that seems even counterintuitively horrible. So what setting aside a worry time is, it's setting aside a discrete time each day, usually 15, 20, 30 minutes. And during that time, you actually are directed to worry, to actively engage in those worries, whether it's how long the coronavirus is going to be going on, or that's whether you're going to lose your job or not, whether your people you're sheltering in place with are going to have angry impulses or disagreements over X, Y, or Z. Sometimes you may come to helpful conclusions or resolution of some of those worries, but the biggest reason or usefulness of the worry time is that it helps you to sequester these worries into one part of your day. And this, again, takes lots of practice. But the other component of the worry time is that if worries come up any other time during the day, and particularly initially, they definitely will, then you instruct your brain, wait a minute, I have my worry time from 9 to 9:30. I don't need to pay attention to that now. If it's not a worry by tomorrow, then great, I don't need to spend time on it. If it is a worry, if it's still an existing problem tomorrow, great, I can focus on that during worrying time. But right now, I am either working, playing, eating, sleeping, interacting with family, friends, something else. I do not need to be devoting any brain time to worrying. And again, it may seem strange, or people might say I don't have any control over it, but the more you practice this, and again, actively engaging in the worry actually helps teach your brain that you can actively unengage or not pay attention to the worry. And yes, this is particularly challenging or difficult to many people with ADHD, but no matter where you're on the spectrum, from no ADDness to extreme, you can become better at learning to channel or direct your thoughts. So that's having a worry time each day. The second anxiety fear reducing technique I'm going to talk about is having a mantra. So that might sound new agey, sitting with crystals or smudging sage or doing something else. But there are actually a few studies right now on PTSD, which has been traditionally in psychiatry one of the hardest, most difficult forms of anxiety, and it does have other non-anxiety components to quell or deal with. For years, the best that psychiatric research has come up for with dealing with PTSD, which doesn't overwhelmingly respond well to any medications has been one form of talking therapy, which is involving exposure therapy, where you actually confront what it is that's been so traumatic or horrible in your future, and you learn to sit with it, and you learn to process and bring in different emotions than what are the fear, terror, anger, other intense negative emotions that are tied to that initial experience or traumatic experience. When exposure therapy requires a lot of commitment on the part of the person engaging in it. Most studies have suggested a majority of people say, I don't want to do that, I don't want to go there. So one of the groups in the VA who are the front row of treating PTSD came up with this approach, which is called mantra therapy. And it proved to be as effective as our exposure approaches to dealing with anxiety. And the practice is ridiculously simple. It's as simple as learning a mantra that's relatively short, relatively soothing, calming, grounding to you, and learning to chant it, for some people out loud. You can chant it to yourself. And that measurably helps ground people, helps get them through a situation. So, I mean, the mantra does not have to be a Sanskritian yoga om. I mean, preferably, actually, it's a fewer words in your native tongue that make sense to you. For one of my patients recently, just chanting, I am brave. She actually, when we talked about this technique, remembered in childhood, she had used this very approach without even knowing it was a sophisticated, well-researched approach for treating anxiety. So when she would be in situations where parents were fighting or being exposed in school to new challenges that were terrifying to her, she would chant to herself, I am brave, I am brave, I am brave, I am brave. And that helped her relax, helped her parasympathetic nervous system kick in to calm down the anxiety in her body and helped her get through it. Similarly, I mean, at least in my childhood era, we were often told about the little engine that could, and the I think I can, and sort of many people chant that to themselves. What I would suggest is that probably a better mantra than I think I can is that I know I can, or I've done this before, or I've got this, rather than I think I can, because I think I can leaves you open to doubt that maybe you can't. And the mantra, you want to be calming or soothing. Many other people I've worked with from the religious traditions, I mean, part of saying the rosary, part of phrases from the Quran, other religious traditions often employ chanting, the repeating of a familiar phrase, saying your Hail Mary, saying something over and over again that may be particularly grounding because it feels it attaches you to your religion, your God, something bigger than you, but mantras can certainly be used in a completely secular humanist way that are not tied to religious or even particularly spiritual beliefs. So the important things with the mantra is that you spend some time each day practicing it, because what we know is when fear, anxiety, we talked a little bit about anger last week, when strong emotions hijack your brain, not only are they bringing out a physiologic response, not only are they causing facial expressions to do something, but they are also shunting blood preferentially in your brain. So your cognitive thinking, your thinking brain usually is less engaged. So you want a response that's well rehearsed, sort of almost automatic, that you can just summon up without having to think, what am I supposed to be doing now that I'm feeling anxious or afraid? So you want to practice the mantra ahead of time, and learning to chant it to yourself without feeling self-conscious may also be a barrier for some people, but practicing that is helpful. So a few things that I'll say we know aren't very effective approaches for anxiety. So the first one I'll get to, alcohol, is actually both effective and not effective. And by that I mean alcohol does measurably, through its action on the GABA system, which is an inhibitory pervasive system in the brain, does acutely decrease anxiety. The problem is it's not getting at whatever caused the anxiety, it's not making the situation go away. And when alcohol wears off, so if this is your anxiety level and alcohol brings it down, every drug we have that brings anxiety acutely down, when it wears off, actually increases anxiety. So there's part of the withdrawal is an increase in anxiety. The good part of the withdrawal, if there's a good part, is that it doesn't shoot your anger up as high as it brought it down. So the magnitude of the withdrawal effect is usually smaller, but the duration of withdrawal is usually 2, 3, 4 times as long as the relief period. So with alcohol, many people get 2, 3, 4 hours of relief from their anxiety if they dose it right. On the other hand, then they're probably withdrawing for actually the next 12, 18 hours, and anxiety will be slightly increased during that time. Another approach we know that doesn't work is avoidance, and that's one that many people with ADHD go to. I mean, what we know is that if you run away from fears, they tend to grow bigger. They increase in magnitude, so avoidance is not a particularly useful strategy. And one other strategy that measurably does not work very well is reassurance. What you want to actually teach someone to do is teach them how to reassure yourself. But if you're always giving reassurance, either as a therapist, as a parent, as a friend, if you're telling them, no, coronavirus will, this sounds horrible, only kill 1 or 2% of people at most. If that is reassuring to the person, you're not likely to die from it. If you're just telling them that, they're going to need you to keep telling them that. I mean, it may quell their anxiety for a few minutes, but if they're not able to tell themselves that, then they're actually becoming dependent on you to decrease their anxiety, which is essentially forming a mild addiction in a way that's not helpful. It's not eradicating the anxiety itself, it's sort of putting a blanket over it. So you want to encourage approaches, and meditation, the mantra, worry time, all can work towards that end, and many of the cognitive behavioral approaches, which specifically look at misunderstandings, underlying assumptions that are inaccurate, to change thinking. You want people, including yourself, if you're anxious, to learn to reassure yourself, not to rely on others for reassurance. So that's about all I will say right now on anxiety. So again, if anyone who's watching has questions, I'm happy to try to answer them. Next week's session, again at 11 o'clock on Friday, is going to be more fully jumping into sleep, because even though we talked about falling asleep issues and scheduling bedtimes a few sessions back, there are more pervasive issues with sleep. And what I'm still hearing, even though in some areas our sheltering in place are loosening up a little bit, is that lots of people are still having sleep issues. And I've also been less than impressed with some of the, even on good radio stations, some of the information on sleep. It's not that I've heard inaccurate things too often, it's that there are, I think, important guidelines, points, reminders, tips that aren't being pointed out. So it looks like I'm not seeing any questions. So again, if you have them later when they come up, you can certainly post them on the video, which should be posted within a few minutes, depending on FaceTime. It's not something I have to, not Facebook, sorry, Facebook. That's all for today. Stay sane, stay safe, and I hope you have a good week.